Hello, welcome to Zigmatech Learning Hub. I'll be your instructor for biology. For this class, we are going to be taking our exercises from the Examguide app. Now, if you don't already have this installed in your device, I would like you to download the app in order to follow along in this class. Now, Examguide is a leading educational app that helps students prepare adequately for various exams. Exams such as the UTME, the post-UTME, WEAC, GCE, IJMB, KCPE, JUPEB, Calbepedia. In the junior sections, we also have the BECE, we have the SSCE, and so much more. Now, you can download the app from www.examguide.com or you visit the Google Play Store to download. Now, please subscribe to our channel and turn on the notification bell to update yourselves on new videos that will be coming up. Now, if you're ready for this class, let's get started. Today, we're going to be looking at microorganisms and better health. Microorganisms and better health. We have been actually discussing a lot on microorganisms. We started with the microorganisms around us. And there we were actually looking at the different types of microorganisms. And we said we have the virus, we have bacteria, we have protozoa, we have algae, and so on. We said these are the different types of microorganisms. And we went ahead to do a little description of these microorganisms. Also in microorganisms around us, we discussed culturing technique, how to grow bacteria or microorganisms in the laboratory. And then when we talked about microorganisms in action, we were actually looking at the benefits of microorganisms, and we were also looking at some of the harmful effects of microorganisms. Today we're going to be looking at microorganisms and better health. If you could remember, I gave you some important facts about microorganisms. One, we said that microorganisms can be found everywhere. Number two, we said that some microorganisms are harmful while some are beneficial. And then we also said that microorganisms can be grown in the laboratory mostly for studies and researches. And then we also said that microorganisms, especially the harmful ones, can be controlled. So in this particular topic, we are going to be majorly looking at how to control the spread of microorganisms, mostly harmful microorganisms. And today, the subtopics we are going to be looking at, we are going to be looking at several subtopics. We have example, we're going to be looking at how to control microorganisms, steps that are involved in controlling harmful microorganisms. We are also going to be looking at control of vectors. If you could recall also when we were talking about microorganisms around us, I told you of the place of vectors. Vectors are simply referred to as living carriers of microorganisms. So one of the ways to curb or control the spread of harmful microorganisms is to also control their carriers, which involves vectors. We are also going to be looking at maintenance of good public health in this topic. And then finally, we're going to be looking at health organizations, both locally and then international health organizations. Now, there are several objective I have concerning this topic based on your own response. And I can call that my objective. Now, the objectives include, number one, you should be able at the end of this particular lesson to be able to mention some ways microorganisms can be controlled. Remember, we're going to be talking about it. So at the end of this class, you should be able to mention some ways microorganisms can be controlled. Number two, you should be able to mention some ways vectors also can be controlled. Number three, you should be able to mention some ways of maintaining good public health. How do we maintain good public health? And then number 4, you should be able to mention some health organization, that is both international and local health organizations, and tell some of their roles, the roles they play in the society, the roles they play in the ecosystem, all right? So if you're set, let's begin with control of microorganisms. Now, microorganisms can be controlled. We have several ways and methods with which we can control microorganisms or control their spread. Now, one of the effective methods is the use of high temperature. The use of high temperature. Now, this involves heating of carriers, mostly non-living carriers. When we talk about non-living carriers, we're looking at food and water. Now, when you heat them to a very high temperature, you end up, there's also another way of getting rid or killing these microorganisms. Boiling of water. If you could also recall, one of the processes involved in purifying water is boiling. You're always advised to boil your water before drinking. So proper boiling of water and also application of heat to food helps to kill microorganisms in that food, thereby controlling their spread. Number 2 is use of drugs. Use of drugs. Now, we have drugs like the antibiotics that are effective in controlling the spread of most microorganisms, mainly including bacteria. Okay, we have drugs like the chloroquine, we have drugs like the penicillin, the amoxicillin, we have the tetracycline, we have the chloramphenicol. These are diverse drugs and antibiotics effective in controlling and killing microorganisms. Number 3 is the use of antiseptics. The use of antiseptics. Now, antiseptics are actually chemicals that inhibit, that is, they stop the growth of microorganisms. They stop the growth and reproduction of microorganisms. They stop the growth and reproduction of microorganisms, thereby preventing microbial infection. Because if their growth are being stopped and reproduction is also being stopped, it simply means their rate at which they infect and multiply or spread in a particular area is limited. Examples of antiseptics include the hydrogen peroxide. Yes, hydrogen peroxide, very effective. We also have the common ones we can get from the supermarkets. We have the Dettol, we have the chlorine water, and so on. These are some antiseptics that are very effective in controlling the spread of microorganisms. Next on the line is use of disinfectants. Please take note of the difference. Disinfectants are not the same as antiseptic. There is a difference between the two. In terms of antiseptic, we said they inhibit the growth and reproduction of microorganisms, thereby preventing the spread of their infections or preventing them from infecting and causing harm. But in terms of a disinfectant, disinfectants are actually chemicals that kills germs and even viruses. They kill microorganisms. They are chemicals that kill. But in terms of antiseptics, they don't render them dead. They don't kill them. They're just that they eradicate them from, make them useless and powerless. Thereby, they are not able to create any negative effect on the body or wherever they are found. But in terms of disinfectant, they end up killing these microorganisms. Examples of disinfectants include the Izal. I believe you've seen that before. We have the Izal, we have Lysol, we have the carbonic water, and so on. These are effective chemicals used for killing germs and also killing viruses and other microorganisms. Number 5 is quarantine services. Quarantine services. You could remember when we had the COVID-19 outbreak, one of the ways we sort of like the WHO and other scientists and other health workers were able to control the spread of the COVID-19 virus was to apply the service of quarantine. So there was a lot of quarantine. So to an extent, even in Nigeria, many persons were asked to sit at home and not come out, and so many other quarantine services that were involved. Now, what is quarantine? It simply means isolation of infected persons to observe and prefer means for a cure. Isolating infected persons so as to observe them and also suggest or prefer means for their cure. Now, this helps to reduce the risk of spread of harmful effects of microorganisms. It helps to reduce the effects of harmful microorganisms. Now, that is quarantine service. Number 6 there is health education. Very important. Health education. In fact, to me, it is one of the most important way or factor that can help to control the spread of microorganisms. Normally, people will always say, if you're not informed, you are deformed. They say information is power and is key. It's very important one is educated on health matters. Now, it involves educating people on the effects of microorganisms. Still also, during the COVID-19, you could attest with me that there was a lot of health education, health talks, health seminars in all places across the world on how to combat this microorganism. There were cases of washing of hands regularly, wearing of face masks. These communications can be referred to as health education. People are being sensitized on the negative effects of microorganisms and how to control or prevent them from infecting them, all right? So health education is very key. Now, next on the line is immunization and vaccination. Now, immunization is actually the process of inoculating a healthy person with a preparation of a mild form of a pathogen. Inoculating the healthy person with a mild form of the preparation of that pathogen. Now, why is it done that way? It is so that the body can release what we call antibodies. Now, antibodies are actually substances that helps to fight against diseases. Substances released by the body to help fight against diseases. Now, what is vaccination? Vaccination is given to protect a healthy individual against deadly diseases. So you get the immunization and vaccination. Vaccination is also the introduction of vaccines into a healthy person. Now, everyone needs to be immunized against certain diseases. We have several types of immunizations. We have immunizations against cholera. We have vaccination against cholera. We have the same against polio. And so many other diseases can be prevented if people can go for vaccination or immunization. Now, number 8 on the line here is personal hygiene. Personal hygiene. Now, the practice of personal hygiene, that is personal cleanliness, washing your clothes, taking your bath regularly, ensuring that your environment is clean and safe, is also another way to prevent and put a check to the spread of microorganisms in your environment. Personal hygiene. Personal hygiene. So these are some of the ways we can control microorganisms. And the 9th one, which is very important, is the control of vectors. Remember, we said when we began that vectors are actually living carriers. They are living carriers of microorganisms, living carriers. So when we say living carriers, they help to transmit microorganisms from one place to another. They transmit microorganisms from one place to another. So if we can control that, will I call it, means through which these microorganisms can be transmitted, it means we can also help to spread help to control the spread of these microorganisms. So we will be looking at control of vectors. How do we control vectors? There are several ways we can control vectors. Now, vectors includes organisms like we have the mosquito, the female Anopheles mosquito, we have the tsetse, we have the Aedes mosquito, we have the Colex mosquito, and so many of them. The black fly, and so many of them that causes terrible diseases, or in fact that transmits the pathogens that causes terrible diseases. So let's see some of the ways we can control some of these vectors. One on the list is sleeping in rooms protected by mosquito nets. You know, the Anopheles mosquito is predominant here in Africa, mostly in West Africa, especially in Nigeria. Okay, we get more of the Anopheles mosquito. And the one that actually causes malaria is the female Anopheles mosquito. Lord, time will fail me to tell you of a lot of persons that have been affected negatively by this pathogen called Plasmodium that causes malaria. A lot of persons have died in the process, and so many things has happened. Okay, so one of the ways through which we can control the spread of this Plasmodium that causes malaria is the use of mosquito nets. Not just over your bed, but in your windows and as well as your doors. All right. Another way we can control microorganisms is draining of swamps. You know, we live in sometimes areas where we have small collections of water or swamps around us. The more we allow those swamps to stay, the more we breed mosquitoes. Larvae of mosquitoes breed very well in these areas, thereby causing the increase in these vectors. And of course, if those vectors are increased in a particular community, it will lead to an increase in the spread of diseases. All right, the spread of diseases. So please, it is very important, draining of swamps. Draining not just of swamps, draining of gutters and other stagnant waters. I could remember here in Port Harcourt, we have a lot of, we have a particular law which is called the sanitation, okay? Sanitation, I think that should be every last Saturday, it's supposed to be every last Saturday of the month, or in some places you see it at every first Saturday in the month, where we take your time, you take your time to ensure that your area, your environment is cleared, is in a good sanitary condition, including your drainages, including your gutters, including your swamps around your houses, and so on. Now, another way we can also control the spread of vectors is clearing of bushes. Clearing of bushes. Clearing of bushes is also another effective method with which we can control the spread of microorganisms. We also have the use of insecticides. We have the use of insecticides, using several insecticides to fleet the house, okay, thereby killing several vectors, which includes cockroaches, we have ticks, we have mosquitoes, and so on, can be killed with the use of insecticides. Now, insecticides are actually chemicals that kill insects, chemicals that kill insects. We also have the use of insect repellent creams. Insect repellent creams. Now, these are actually lotions or creams that are applied on the body, which helps to resist mosquitoes and other insects from coming to you. Which helps to resist mosquitoes and other insects from coming to you. We have that as insect repellent creams, which you rub on or you apply on your body. Then we also have another very simple technique or method which a lot of persons have ignored, and that is covering of your food. Most persons immediately they are not eating, they leave their food uncovered. That is a very bad practice. It is very healthy if after eating or before eating, okay, or if you have not finished eating, ensure that your food is always covered. Ensure your food is always covered. If flies begin to perch on it, and you eat the food that is infected by a fly, definitely it can lead to diarrhea, it can lead to cholera, it can also lead to typhoid fever. Then we also have keeping the environment clean, like carrying out daily sanitations around your surroundings, around you, clearing places, picking up the litters around, ensuring that the place is comfortable as well as neat. Now, let's look at how we can maintain good public health. How do we maintain good public health? There are several ways we can maintain good public health in our surroundings or in our societies. One of them is adoption of proper and effective sewage and refuse disposal methods. Yes, which is very, very important. Proper disposal, effective disposal of refuse, either sewage or refuse. Effective disposal of them. Remember, sewage is liquid waste, and then refuse is solid waste. Another way we can also maintain good public health is to protect the water we are drinking. Now, one of the ways we protect water we are drinking is by purifying them. Purifying them. And I've told you of some certain processes that are involved in purification of water. We have boiling, we have addition of alum, we have filtration, to an extent we have distillation. We also have addition or application of chlorine when you want to chlorinate a water, and so many other ways we can protect our water from harm because we take it in, all right? Or you can use what we call a chemical called water guard to protect your water. Another way we can also maintain good public health is protection of food by cooking it properly, preserving it in a refrigerator or every other means you want to preserve them with, and then covering of the food. And finally, washing your hands properly before and after eating. Washing of hands properly before and after eating. These are common practices that can help us protect our food from being infected. And then also we have maintaining good personal hygiene. We've spoken about personal hygiene, which has to do with several practices like brushing your teeth regularly, taking your bath regularly, keeping your environment clean, washing of your clothes, washing of your hands after using the toilet, and all that. So many other personal hygienes that must be observed. And then finally, another way we can maintain good public health is health organizations. The roles of health organizations. There are several health organizations, both locally and also internationally. Now let's take a look at some or a very few international health organizations. Now we have one of them which is called WHO. Is an international health organization. We have the WHO, which simply means the World Health Organization. We also have UNICEF, which simply means United Nations Children's Education Fund. And we also have the International Red Cross Society. These are three important health organizations recognized around the world. And then also in terms of local health organizations, mostly in Nigeria, we have a lot of them, but I'll just mention just very few. We have the NMA, which is the Nigerian Medical Association. We also have the health centers, which is scattered all around the country, all around the states rather. We also have federal ministries of health and so many other parastatals or organizations that helps to maintain good public health in our nation, Nigeria. Now let's take a look at one or two of these health organizations and their roles, or the roles they play in maintaining good public health. Now the first one on the list is WHO, which simply means World Health Organization. Now, WHO is a specialized division of UNO, which is United Nations Organization. It was actually first established in 1948, and the headquarters of WHO is Geneva, which is in Switzerland. all right, in Geneva, Switzerland. Now, what are the roles of WHO? I'm going to give you very few of them. Number one, WHO, they publish medical journals. They publish medical journals. Number two is that they help to set up international quarantine regulations. During the COVID-19, they were the ones responsible to set up international quarantine regulations. Number three, they help to provide drugs and vaccines in cases of emergency. More probably if there is an outbreak, a world outbreak, okay, an epidemic outbreak in the world, they help to provide drugs and vaccines in these cases of emergencies. Then also we have, they promote measures for the control of world's major diseases through vaccination programs. Another of the roles of WHO is that they set and recommend safe standards for drugs. Recommend safe standards for drugs. And then finally, they provide warning signals in the event of an outbreak. Mostly if there is an epidemic disease or an outbreak of an epidemic disease, they are the ones that provide warning signals to nations, countries, to be alert and be aware of this epidemic outbreak, all right? So these are the roles of WHO. We also have the UNICEF. UNICEF stands for United Nations Children's Education Fund. United Nations Children's Education Fund. Now, the UNICEF is actually another special division of United Nations Organization, UNO. Now, they are set up to improve the health and welfare of children all over the world. That is one of their major functions. Now, let's take a look at other roles of UNICEF. They improve the nutrition of undernourished children. They feed destitute children. They also provide for the emergency need of children in devastated countries or areas. They also supply vaccines to control the diseases that affect children, and also they provide clothing and other needs for children. These are some of the things that UNICEF do, or roles they play to help and assist nations in the world. We also have the International Red Cross Society. International Red Cross Society. Now, the Red Cross Society, mostly their functions is mainly, actually when it started, it was a health organization that helped during the war and after the war. During the war, most world wars, and after most world wars, you could see International Red Cross Society as a health organization that played a major role to help a lot of persons. Now, some of the roles they played is that they took care of injured people in times of war. They were there to take care of injured people, soldiers and every other persons during the time of war. Also, they provided emergency aids to those in distress in the times of war. Remember, I told you during times of war and also after war. Another function of the Red Cross Society is that they provided welfare for prisoners of war. They also provided transportation for the evacuation of refugees. Now, the International Red Cross Society also assisted in the training of nursing aides. They assisted in the training, or they, even till now, they assist in the training of nursing aides. And they also provide help to victims of natural disaster all across the world. Even in Nigeria, we have a Red Cross Society. Now let's move to local health organizations, mostly health organizations in Nigeria. For time's sake, I'm going to take just one. Now, NMA, which is Nigerian Medical Association. Nigerian Medical Association. Now let's take a look at the Nigerian Medical Health Association, the roles they play. Roles that Nigerian Medical Association play. Number one, they advise the government on health matters. They advise the government on health matters. Number two, they alert the nations, or the nation, let's put it in this way, Nigeria, where there is an outbreak of a disease. Whenever there is an outbreak of a disease, they alert the nation. They also carry out researches into ways of preventing and controlling those outbreaks of diseases. They monitor the recruitment of well-trained doctors in the hospitals. And then finally, they assist in training medical and paramedical staffs needed in healthcare centers. They help in training them, medical and paramedical staffs that are needed in healthcare centers. Now, this brings us to the end on this topic on microorganisms and better health. But before we go, let's take a look at some few questions using the Examguide app, all right? So let's look at questions using the Examguide app. We have very few questions we're going to be looking at. At least let's look at 3 questions. The questions here we have, number one, only specially adapted microorganisms are found where? A, we have moist soil. B, we have humid air. C, we have salty water. And D, we have mouth cavity. The correct answer there is mouth cavity. Now, the reason for mouth cavity is that, as the question implies, they said specially adapted. It means that these microorganisms ordinarily cannot survive in those areas, but they need special adaptive features to be able to survive in those areas. Now, why we said mouth cavity, there are several antimicrobial enzymes that are found in the mouth. An example is the lysozyme. We also have the thiolin and so many other antimicrobial enzymes that are found in the mouth that can destroy microorganisms. So if microorganisms are found in the mouth, those microorganisms have specially adaptive features that helps them to survive in the mouth cavity. Number 2 question is, oil is spread over stagnant water in which mosquito breed in order to now remember we talked about control of vectors. We said one of the ways to control the spread of microorganisms is actually to control their carriers, their living carriers, which are vectors. Now, as the question implies, one of the ways also we can control mosquitoes, which causes several diseases or transmits pathogens that causes several diseases, is to spread or to pour in oil, or yes, to spray oil on stagnant waters. And one of the reasons for doing this, one, is it to provide the water to prevent the water from overheating? No. Is it to provide landing surface for the adult? No. Is it to prevent larva or pupa from attaching itself to the surface? And the correct answer is C. C is the correct answer. And then finally, question 3. Which of the following organisms causes syphilis? I think we looked at this when we were looking at microorganisms in action. And the correct answer is Treponema pallidum, which is option D. Thank you for participating in today's class. You can practice more questions using your Examguide app. The app scores and gives a detailed explanation of all the questions at the end of your practice test. You can also learn particular topics of interest with different modes, like study mode, mock mode, and even practice mode. It also has other features that makes learning very fun. Now, it is a must for all serious students. Download from www.examguide.com if you don't have it yet. See you in the next class. Don't forget to subscribe to our channels, hit the notification bell, and share the videos to your loved ones and friends that will benefit from it. Bye for now.